Common diseases in cattle. Disease has been broadly defined as any condition in which there is a deviation from health or normal functioning of any or all the tissues and organs of the animal body. Most of the diseases are caused by pathogenic bacteria, viruses and parasites. The common signs of ill health are 1. Stoppage of rumination. 2. Loss of appetite. 3. Decrease in milk yield. 4. Dull eyes and drooping ears. 5. Dry muzzle. 6. The coat will be rough. 7. There will be some discharge from nostrils, mouth and eyes. 8. Restlessness, they will be changing the posture frequently, keeping the head down. 9. Difficulty in breathing. 10. Rise in temperature. 11. Higher rate of pulse and respiration. Bacterial diseases. 1. Anthrax, splenic fever. The causative agent is Bacillus anthracis. The attack is by ingestion and infection from infected pasture, water, feed and fodder, and biting of insect fig. 1.4.10. Anthrax affected cattle vectors. Incubation period is 1 to 5 days. The symptoms vary according to the severity of the attack and to the species affected. The disease may occur in acute, subacute or chronic form. The disease is characterized by sudden onset of symptoms and death. Foamy blood from nose and mouth is expelled and sudden death results. In acute form there is sudden rise in temperature, 105 degrees Fahrenheit to 108 degrees Fahrenheit, abortion in cows, bloody discharge from the mouth and nostril, blood-stained diarrhea, straining during defecation, and in subacute form the animals die in 3 to 5 days or longer or affect complete recovery. In chronic form, the local lesions confined to the throat and swelling occurs occasionally in cattle. Diagnosis is by clinical signs and confirmed by laboratory examination. No post-mortem should be done because opening or skinning the carcass result in spreading the infection. Treatment and control. 1. Penicillin should be given to treat the infection. 2. A strict quarantine of the infected premises. 3. Prompt disposal of dead animals by complete incineration or deep burial under a layer of quicklime. 4. Disinfection of contaminated sheds, control of insect, vectors and other carnivores, rodents and crows that feed on the carcasses should be done. Prevention and vaccination. Anthrax spore vaccine can be given. Mastitis. This is a condition rather than a disease of high economic importance. An acute or chronic inflammation of the mammary gland, caused by physical, chemical and biological agents chiefly of bovines, usually affecting the secretory cells and frequently causing total suppression of milk. A large number of microorganisms have been implicated in mastitis. They are divided into 2 groups. Infective group includes Streptococcus agalactiae and Staphylococcus aureus, and pathogenic group which includes Streptococcus dysgalactiae, Streptococcus tuberous, Carinebacterium pyogenes, Escherichia coli, Mycobacterium tuberculosis, Actinomyces bovis. Infection occurs by microorganism gaining access into the udder through the teat canal. The predisposing factors may be in the individual cow or the herd as a whole. They include age of the animals, stage of lactation, milk yield, hereditary factors, trauma or injury of the udder or teats. The symptoms are subclinical mastitis. This can only be identified by laboratory examination of milk drawn from the udder. There are no visible signs. This is also called latent mastitis. Chronic mastitis. It is characterized by repeated mild attacks of mammary swelling, with the production of clotted milk. Acute or severe clinical mastitis. It is usually sporadic and is characterized by rapid onset of a diffuse swelling in a quarter that has been normal previously. There is a pain on palpation. The milk is not normal in appearance. High fever and anorexia is noticed. In per-acute cases, fever, depression and anorexia are also seen. The diagnosis is based on the symptoms which are seen in acute, per-acute and chronic cases, and subclinical mastitis is diagnosed by laboratory tests. Examination of milk samples for cells, bacteria and chemical changes helps in identification of causative agent. Treatment and control. The disease can be controlled by protecting the teats from injury and isolating the infected animal. Wipe the teat with dry cloth after milking. Other teats and milkers' hands should be washed with antiseptic solution. A cream containing 0.5% Z.MC oxide may be applied on teats abrasions. Maintaining hygienic conditions of surroundings, keeping the animals clean and healthy, and early detection. Additional information. Black quarter. It is caused by Clostridium chovoet. The mode of tea infection is by ingestion of the contaminated food and water. The incubation period is 15 days. The symptoms are acute lameness with a hot, tense and painful swelling varying size situated usually in the hindquarter or forelimb, accompanied by high temperature. When the swelling is incised, a dark frothy fluid escapes and the fluid has a very sour smell like that of rancid butter, crepitating sound on pressing the affected part of the muscle. Calves below 6 months of age and up to 3 years of age are not usually affected by this disease. Diagnosis is based on symptoms, animal inoculation of dried piece of affected part and culturing of organisms in the laboratory. Control. Local administration of antibiotics will be helpful to ease the recovery. All affected animals should be isolated. Dead animals should be promptly buried with lime. Annual vaccination is helpful in control of the disease. Prevention is by black quarter vaccine. Brucellosis, contagious bovine abortions, Banks disease. The disease is caused by Brucella abortus. The mode of infection is by ingestion and through breeding with infected bull. The incubation period is about 21 days. The affected animal shows symptoms like abortion during the last stage of pregnancy. The placenta is usually characteristically altered and it is streaked with a yellowish slime, and the cotyledons become flaccid and covered with creamy yellow coating. The diagnosis is by clinical symptoms like abortion of number of cows at a time. Viral diseases. Foot and mouth disease, FMD. The causative organism is virus. The disease is transmitted through ingestion of infected feed and water, etc. The period of incubation is 2 to 10 days. Symptoms of foot and mouth disease include rise in temperature up to 104 degrees Fahrenheit or more. The temperature lasts only for a couple of days, that is up to the appearance of the vesicles. Vesicles are commonly formed in the mouth and feet, on the udder and teats. Copious saliva secretion and rounded blisters like vesicles appear on the inner side of the lips, gums, dental pad, palate and tongue. Diagnosis is made by the presence of vesicles and ulcers in the mouth and feet, on the udder and teats. Treatment. Wash the mouth with Camno4 lotion 1-200 solution, and foot lotion should be treated with 1% copper sulfate solution or phenyl lotion. Control. Controls includes isolation of sick animals, quarantine of premises, disinfection of premises and slaughter and disposal by burial or burning of all infected materials. Non-specific diseases. Ketosis. This is a metabolic disorder due to disturbance in carbohydrate metabolism. The cow derives energy not from carbohydrate source but from protein and fat depots of the body. This increased gluconeogenesis enhances the activity of gluconeogenic enzymes. Level of oxaloacetic acid becomes deficient, resulting in slowing of TCA cycle, resulting in accumulation of ketone bodies. The affected cow will show loss of appetite, reduced rumen activity, dullness, and decrease in milk production with high fat content. Animals will have unhealthy appearance with drooping nature, discharges from eyes and nostrils, dry muzzle, sudden loss of body weight. Blood glucose level is reduced to 20-40 mg/cent. Blood ketone level goes up to 100 mg/cent. Urine level of ketone bodies is 80-1600 mg/cent, indicates ketosis. Treatment. Administration of 500 ml of 50% dextrose by intravenous injection for 3 days forms the first line of treatment. Other control measures include feeding according to the production, proportionate amount of roughage in the ration, not starving or fattening just before parturition. Cutting down the ration should be avoided. Milk fever. This is also known as hypocalcemia and is a metabolic disorder due to acute fall in blood calcium and magnesium levels, possibly due to draining of the same at the onset of lactation. The condition occurs generally during the early stages of lactation, especially in high yielders. Symptoms are loss of appetite, constipation and restlessness during the first stage. There will be muscular weakness and unsteadiness in movement, and animal becomes recumbent with its head usually inclined laterally. The diagnosis can be made from symptoms and history of the case. Treatment is by the injection of a calcium salt in the form of calcium chloride. The condition can be prevented by feeding balanced rations and free access to a suitable phosphorus and calcium supplement. Increased calcium and phosphorus content of feed through fertilizing the soils. Vitamin D therapy may be of some assistance. Maintaining calcium-phosphorus ratio 2.5:2 in the diet.